Welcome to the Secrets of College Planning. I'm your host, Anthony Uva, and today we hope to give you some insight on how you should prepare for college. My guest today is Dr. Stephen Marcus. He's the professor for preventive medicine and community health for New Jersey Medical School, Rutgers University. Welcome to the show.
Thank you.
Yeah, no problem. So usually I start my guests where they went to college, and for yourself, where you went to many different colleges, I assume, to become a doctor.
Well, I went to a college in the city of New York. I went to Brooklyn College. I lacked, because of that, some of the experiences of going away to college. But that's one of the reasons that we think it's very important is that many times the student, this is their first time really to be out of the house, out of the nest, so to speak. So I didn't have that experience, and I'd like to make sure that students are prepared for that experience. As far as medical school, I went to the Medical College of Virginia in Richmond, Virginia. I did residencies in pediatrics, both at Bellevue Hospital and at New York University, as well as Albert Einstein College of Medicine and Jacobi Hospital. And I did a fellowship in medical toxicology at Harvard Medical School and the Boston Children's Medical Center.
Oh, great. Well, that's a very long list. So now, how does someone go from all of these colleges that you've gone through to get all this education that you need to become a doctor, to a professor at the New Jersey Medical School?
Well, I mean, you've got to, it's kind of like, how do you get to Carnegie Hall? Practice, practice, practice. So, my interest has always been in preventive medicine, and the research that I've done and the clinical service that I've done has been aligned to that field. My interest in various kinds of poisonings led to my becoming involved in toxicology and the running of the State Poison Center here in New Jersey. Because of that, I became very interested in the problems that many of our high school and college students have as far as their exposure to various substances, mind-altering substances, and have been very involved in many preventive task forces, what have you, and trying to educate students and trying to help them, through the course where they're going to be exposed, like it or not, to these substances. And whereas just say no, I don't think is the answer, we have to have a better way to educate the students and help them through it. And that kind of leads every year to our effort during the summer months to remind everybody through media releases and what have you of the dangers of going away and not having built-in control systems.
Gotcha. Now, is that what your class is about?
Well, when you teach in medical school, it's not that you really have a class per se. We do have a couple of sessions that we do teach in the year, but our teaching is more informal. It's bedside teaching, it's discussion with people that are rotating with us. Right now, for example, we have two pharmacy students from the Rutgers College of Pharmacy. We have an emergency room resident from our hospital, as well as from Robert Wood Johnson University Hospital comes. We have pediatric residents from several different hospitals in the state as well, and we come and we discuss. One of the very common discussions is, the adolescent and the reactions the adolescent has to the stress. That can be from suicide attempts to the abuse of alcohol and other drugs.
Wow. So now, preparing for college, the parents that are out there getting their kids ready to prepare for college, what are some of the steps they need to take to prevent some of these issues that are happening at the college level?
Well, I think we ought to divide the preparation to a few things, and I'm certainly not going to talk about the economic. I don't know how parents can send their kids to college anymore. It scares me to think of what my children will have to pay to send their children to college. I'm not talking about that, and I'm not talking about the clothes and the rest of that stuff. But they should have some things on their preventive medicine sheet, if I can call it that. One is to check with their physician to make sure the child, I hate to use that term, but I don't know what else to call them, the person that's going to start the school. Make sure they've had all their immunizations, all their blood work, make sure everything is fine before they start school. Last year there was this outbreak of meningitis right here in Princeton. There are frequently outbreaks in colleges of various other preventable illnesses. Right. And right now we're beginning the flu season, and people forget about the common illness. Everybody's interested in Ebola, and they don't think necessarily about influenza. And if any of the students that may be watching this or their parents have not had their influenza shot this year, we certainly strongly urge them to get it. I mean, if influenza hits a college, particularly in the dormitory, it gets spread like wildfire. Yeah. And although the vaccine's not 100% effective, at least it gives that much degree of prevention. So those kinds of things should be on the list, and they rarely are. I mean, many of the schools send a medical form that has to be filled out, but parents don't necessarily take it that seriously, and the student that's starting college may not take it seriously. Yeah. I think there are some discussions that have to take part sort of along those lines as well, between the parents and the child as far as sexuality. There are going to be times where there is going to be some exploration, let's put it that way. And a discussion should take place between the parents and the child, I don't care whether it's male or female, about what they may be exposed to and how to handle themselves in that situation. If a young woman has not already spoken to her parents about her sexual activity, the doggone sure it better be done before they go away to college, and a discussion on safety and avoiding the risks of infection and pregnancy really should be entered into. It would be best not to wait until August of the year they're starting school. Sure. That hopefully would have been done for years in advance, but again, on the tickler list, as I call it, that I'll call preventive medicine, that should be on it. And there is a vaccine now that is useful to prevent a certain kind of venereal disease that actually is a precursor to cancer of the cervix. And there's a lot of controversy over that. But I think a parent and both children, because it's now even suggested that the guys get the vaccine as well, I think that discussion needs to be had. Mm-hmm. The other thing, because I am a medical toxicologist, and every year we see various kinds of problem associated with drugs, either illicit or prescription, and also with alcohol. And I guess we ought to start out with alcohol, because it's probably the most commonly used substance. We've had a good and bad thing by years ago setting the drinking age at 21. We're kidding ourselves that we think that kids are going to wait until they're 21 to start drinking. It obviously is going to start earlier, and often it starts even in high school and what have you. But the association with alcohol and college and overdoing it with alcohol is really very, very important. There are peer pressures as far as drinking. There are games and what have you. Years ago, by the way, there was a game called Quarters. I don't know, I don't know whether they still do it, but we had any number of college kids in hospital emergency rooms swallowing the quarter. Oh my God. And one actually had to go to the operating room to get it out. So, I mean, those games and things, it's important for people to discuss with it. You always, every year, you read about one or two college students somewhere in the country dying from overdosing on alcohol. And it's kind of important for somebody to talk to the student, explain to them how much it, could end up causing trouble. And that's a difficult discussion because we technically think it's illegal until you're 21. So it's kind of almost a banned subject, but I think it's a very important subject. Right now, with all the publicity about date rape and sexual harassment and stuff, it's also very important to talk about the association between alcohol and that on both the victim as well as the perpetrator. Again, people have to understand how much alcohol may be consumed until you get to the point where you have no control over what you're doing. I told my girls when they went away to college that I wasn't condoning their drinking, but they were to make sure that what they drank was from an unopened bottle before they started drinking it, and they were to keep their hands on it, and if they ever put it down and left it for a moment, they were to get another one. The very common red plastic glass that somebody pours something in, I told my daughters, and I would tell everybody out there, don't drink it. You have no idea what might be in it, what somebody might have slipped into it for fun or for some malicious intent. So that's kind of important. You ought to remind them when they begin to feel that they're losing control, that's a time to stop. Yeah. No matter what anybody calls you, stop. Chug-a-lugging, which has been a common sport in college kids, for as long as I am aware, is extremely dangerous because you might drink more than enough to hurt you, and it may take a while for it to all be absorbed, so you might not even know what's going on. So people have to keep their own track of how much they're drinking. Those are things about alcohol that I think are very important. Drug use, we did a survey recently on some students to find out how many of them were using prescription medication obtained one way or another to study. And it was not uncommon, even back when I was in school, that people using study aids, anything from caffeine to amphetamines, to uppers. And nowadays there are drugs that are used for certain syndromes that are associated with difficulty in attention and what have you. And many of the college students will beg, borrow, steal, or what have you to try to improve their grades. That can be a real double-edged sword, and we really warn students not to go down that pathway. Every drug has a potential for side effect, and yeah, to some extent the side effects may be dose-related, but you can also have what we call idiosyncratic reactions, where even taking one dose of the drug can have really bad effects. And then what happens is you take the drug to help you stay awake, and then you can't fall asleep, and so what do? You go out and either drink alcohol or take another drug to make you go down, and then we get this mishmash of drugs. And then what happens? They end up in the emergency room, at best, where we at least have a chance to treat them if they're really in trouble. Sometimes they'll just be left in bed by somebody or in a room, and the worst can happen, including, as I mentioned, the couple of deaths that get reported every year nationwide. So again, we caution that. And over the last, I guess it's 4 or 5 years, there's been the introduction of what was loosely called legal marijuana. The synthetic cannabinoids, these are chemicals that are actually synthesized in laboratories to affect the same receptors in the brain that marijuana affects. Because the government doesn't ban them specifically, until we get wind of them and they then get banned, they're actually considered legal. But that doesn't mean they're safe. And just because they may come from some natural product or what have you, again, doesn't make them safe. We've had, a fair number of really bad episodes in New Jersey and certainly nationwide from this emergence of drugs. I'm on a telephone conference call at least once a month from around the country, trying to keep our handle on what's emerging, and then to see what we can do to mitigate it, to try to prevent it from getting into the hands of the user, and what do we need to do once it's in the hands of the user and the user has a problem with it.
So what are some of the preventions that parents can say to their kids to slow it down? Because most of the time it's the student, finally getting away from the wings of their parents, that they get to go to college and all of this happens. The drug use, the sex, the alcohol. It all starts because they finally get away.
It's been going on for probably thousands of years. When the child leaves the nest, they then try whatever they can. And for example, with alcohol, I mean, there's evidence that even prehistoric man was using alcohol probably to get high. Is my hunch. So that people will try things. And the family needs to sit down and discuss what is going to happen when you leave the nest, and how to protect yourself and how to react in those situations. The college situation is somewhat unique as far as that's concerned, because the college almost feels to the individual child like a home, and home means safe. So they, when they go away, they feel that they're in a safe environment. That age that kids go away to college is also an age where they feel that they're omnipotent and omnipresent, and therefore nothing's going to go bad for them. That, yeah, things can go bad for somebody else, but like with alcohol, I can hold my own liquor and all the rest of the stuff. And so family really needs to sit down and discuss that. Not pejoratively, not saying, you don't know what you're talking about or what have you, but discussing the elements of that. Discussing, what's the difference between beer and hard liquor, and, the difference between casual relationship and the sexual relationship, and discussing, quite frankly, in the context of the sexual relationship, ways to make sure you don't get sick. When I was in college, the fear is if you had sex, you were worried about getting pregnant. Well, now it's getting some other sexually transmitted disease. We don't hear that much about AIDS anymore, but it's still there, and
right.
People are still getting diagnosed each year with it. So it is something to contend with, and people have to understand that if they choose to sleep with somebody, they're not just sleeping with that person, they're sleeping with everybody that person has slept with before as well. So I think that's something that needs to be discussed.
So how early do parents start this discussion with their sons or daughters? Is it freshman year of high school? Is it when they're seniors?
I would hope it would be even before that.
Really?
But discussing it in terms that the child can understand at that age. But again, as you get closer and closer to that child leaving the nest, it has to be more targeted into specifically what are you talking about.
Yeah.
And that is, again, and I may offend people out there, But I would think that you need to assume that your kid's going to drink. You assume that your child or student or whatever you want to call it is going to be exposed to the drug scene, and assume that they're going to be exposed to the sexual connotations. And you need to discuss with them what to do if you got yourself into a position, and how do you get yourself out of it. And we always talk to our children and said, look, if you're at a party and things get out of hand and you're uncomfortable, pick up the phone and call. You know, certainly when they were in high school and we were near them, we'll be there in a minute. You know, any time of the day, what have you. It's a little more difficult depending how far away somebody may be. But again, there are ways to structure it with the student, so that if they feel uncomfortable, there should be somebody that they can call.
Do you see a difference with the students that stay closer to home compared to students that are further away from their home?
I can't really answer that. Most of the times when we get called, let's say at the Poison Center, because some student is hit the emergency room drunk or on some drug, we don't really ask them, you know, where did they live and, you know, where do they go to school. We usually have a pretty good idea where they go to school, depending on which emergency room is calling. But that's not something we've ever actually looked at. I would assume that that if you lived at home and traveled, you know, commuting to school, that it'd be a little less likely that this escaping the nest syndrome would occur. But I'm sure it's still certainly very likely to occur to some extent.
Yeah. So, and do you see a difference between men and women? Is there a larger amount that do it as women, or is there a larger amount that do it as men?
The deaths that we see annually tend to be more in men. I think men are more risk takers than women. The sexual assault stuff that you read about tends to be women. Now, part of that is that even though women don't report it as often as it probably occurs, a woman will probably report it more often than a man will report it. So I think that dichotomy may or may not really exist. It's tough to know. As far as the adolescent suicide attempts, that is more often female than male, and that's scary. And that's another thing that parents really need to early on be talking with their children about. I get depressed when I look over our cases at the Poison Center and see the 13, 14, 15-year-olds that are, for reasons that we don't know because we don't go into that, have found it, the necessity to try to kill themselves.
Is that usually cases that they've already been taking some type of drug in the high school level that it happens, or are people just doing it off the whim?
Well, there are some where there may be a fight with the parent or something, rather than the child, kind of lashes out by taking an overdose. And there are others where we don't really get a good handle on what precipitated it. To be honest, from my vantage point, my staff is more involved in trying to help them when they get sick from it. There was an article in this month's, I think it's American Journal of Psychiatry, that looked at adolescent suicide attempts and what happens to them, and looked at it not just as far as do they repeat their attempts or what have you, but how long after that do they seem to manifest serious psychological problems, and it seems as if it lasts for as long as decades after that. How much of that might have been preventable if parents had been more open with discussing emotional problems with their children when they were younger? It's tough to know. But again, those magic years between becoming a teenager and going away to college and being in college, that can be very stressful and very dangerous.
Yeah. So we're coming to the end of our show already. But what I'd like to ask you, usually what I ask my guests at the end, is what do you want to leave to the parents that are out there? What are some of the steps they should be taking to send their kids off to school?
Well, they need to be very proactive. Parents tend to prepare to how to move the child, what kind of clothes to get, what kind of books to get, what kind of computers to get. But the emotional portion of going away and the preparing for the stresses and the peer pressures is, to me, much more important than, do they have enough, socks to go away to school for or what have you. And, I'm going to go back to the medical portion of it as well. I am a physician. To make sure that their children are properly protected from diseases. That's including having a well-done physical exam before going away, making sure immunizations are up to date, make sure that there's no hidden illnesses that might impact on the performance in college.
Great. Well, thank you very much for coming to my show. I appreciate it.
My pleasure.
And so you've been watching The Secrets of College Planning. I'm your host, Anthony Uva. Until next time.